Welcome to Save As Ability, a podcast to educate and inform you about disability employment issues. My name is David D'Arcangelo, and I'm your disability policy expert. Hey everybody, welcome back for another episode of Save As Ability. What is disability? That's what we're talking about today. This is coming from viewers, really, and people who have been searching YouTube for this. So we're going to answer what is disability today. And really, it's an essential question and I can understand how people are a little confused, like what is disability? Because I think it's evolving over time and has evolved, right? Traditionally, the archetypal metaphor for a blind person, you didn't think necessarily of somebody like me who's legally blind. You thought of a person with a cane and a guide dog and, they couldn't see at all. I think those barriers are coming down now, and I think we're understanding more about disability of all prevalence types. So today we're going to talk about what is disability and really, again, understanding what constitutes disability, and it's measured in different ways. So why are we doing this? Well, we're doing this because we want to be able to create effective policies that work for people with disabilities, that work for Americans and individuals with disabilities so we can support them and really provide them access to opportunity. That's what we're trying to do. Our goal at Save As Ability is very clear. We're here to improve the human condition. Now, that's a lofty goal, but that's what we're trying to do in our own little corner here. All right, so let's get right into it. Our task of understanding what is disability. So again, back to definitions we've talked about in so many episodes. But I've broken it down here that I think we're going to be a little bit more clear for people who are seeking to know what is disability. So there's different definitions used by different organizations, particularly governmental organizations, and they're found in the laws and various legislative frameworks. All right. So we're going to start first with the United States Census Bureau. Well, we're starting there first. Why? Because the United States Census Bureau produces a survey called the American Community Survey. This is probably the largest survey that's put out measuring the number of Americans with disabilities. Okay. So, there's the annual census, the census that happens once every 10 years, but the Census Bureau is working all the time to administer the supplement surveys. Okay. And so again, to the definition, the ACS defines disability as one of 6 types of difficulties, and that is a difficulty with hearing, vision, cognition, ambulatory, self-care, and independent living. And they ask a series of questions around that. So these questions then break up into what we call 6 different prevalence types. All right. So if a person reports difficulties with any of the lists that I mentioned there, the hearing, the seeing, the mobility, all of that, they're considered to have a disability under this definition that the Census Bureau is using, that the American Community Survey is using. All right. So I started with this definition because that's really gives us the largest data point to start with. All right. And by using this definition, it indicates that there's about 42.5 million Americans with a disability. That's approximately 13% of the population of all Americans have a disability. All right. So there are other surveys, though. So there are other ways to define, and something put out by the Census Bureau themselves. Again, they administer what's called the Survey of Income and Program Participation, or the SIP. Okay. Now, this takes a slightly different approach than the ACS. The SIP defines disability based on the presence of specific impairments and the degree to which these impairments limit activities. So it's slightly different. And this includes things like sensory, physical, mental, emotional impairments. And the surveys conducted by in-person interviews, which is different than the administration of the ACS. So now you say, well, wait a minute, what is disability? Again, we're back to that. The amount of the ACS we indicated was 42 something million, 13% approximately. But the estimate of people with disabilities by the SIP is substantially smaller. That comes in at around 28.8 million. So we see that now how we're measuring it, how we're defining it, is really then going to produce you different data. That's how many people are going to be considered people with disabilities under that rubric, under that metric. All right. So next, there's another one called the Behavioral Risk Factor Surveillance System. This is put out by the CDC, the Centers for Disease Control. This is more of like almost like a public health type of approach. This system defines disability as having activity limitations due to physical, mental, or emotional problems, or having health problems that require the use of special equipment such as a cane, wheelchair, special bed, or special telephone. So again, this survey administered by the CDC takes more of a public health approach, and because of the activity limitation prerogatives of the survey, the estimates for people with disabilities are substantially higher than other surveys. So their documentation indicates that there could be as many as 61 million Americans with disabilities, again, by using their specific definition, with their methodologies, with their survey administration and all that, the way it's reported up through local departments to state and, all of that. So we see that there are various, very varying numbers of people with disabilities depending upon the type of the survey. All right. Then we look at really, to me, one of the larger definitions of disabilities, and that's the ADA, the Americans with Disabilities Act. That has the three-pronged definition. It's probably the most well-known definition at this point. It defines disability as a physical mental impairment that substantially limits one or more major life activities, a record of such impairment, or being regarded to have such impairment, right? So similar to that is the Rehab Act of 1973, and that is defining disability as a physical or mental impairment that substantially limits one or more major life activities. This laid the groundwork for the ADA definition, all right? Now, looking at those two numbers are closer to the ACS number, but the estimates of how many people are, quote unquote, covered by these definitions are going to be different and slightly different estimates, right? All right. And then finally, let's talk about one that's more of like an accounting of it, not necessarily like a survey. And this is like program data that we're using here, and that's from the Social Security Administration. So SSA has a much more stringent definition of disability. The SSA defines disability as the inability to engage in any substantial gainful activity due to a medically determinable physical or mental impairment that can be expected to result in death, or that has lasted or can be expected to last for at least 12 months. So you can see now that this data indicates many less people with disabilities. The estimate here is around 10 million Americans receiving these disability benefits through SSA. So you see a very wide range here. We have 10 million, we have 61 million, and then the ACS is at 43 million or something like that. So again, depending upon how you define it, what is disability is by these various definitions. This is why we talk about it so much on this program, because depending upon the program, depending upon the law and the definition of disability is really going to depend upon, who we're talking about and what is disability for each individual. All right. So we know that there's variations through all these definitions, but there are common data points that emerge. And this includes things like physical impairments, physical limitations, mental or cognitive impairments or limitations, the impact on daily activities or major life activities, use of special equipment or assistance, and the long-term and chronic nature of the impairment or the limitation. So these are kind of like the common denominator concepts of disability. And again, depending upon how specific and the particular program that you qualify or don't qualify under, right, that's going to really mean what disability is for that person. And it's going to be unique for all Americans because you may qualify for one program, but not the other. That doesn't mean you're not necessarily a person with a disability. We've talked about it. One of the reasons why the ADA definition is so broad is to ensure that we're protecting people with disabilities from discrimination. At least that's the goal. So disability is multifaceted. We know that it's a spectrum. We care about all of our people with disabilities here, and we don't want anybody to be discriminated against. And that's why we have things like the ADA, which is so good. So, by understanding these definitions, we can make improvements. We try to do that here. That's what we're advocating for. We're trying to promote access to opportunities here for people with disabilities. And we can do it. There is no one-size-fits-all approach. There's no exhaustive list of disabilities. We know that. So it's complex, but there are some common denominators here, as we've talked about. So, again, this came in from various people asking questions. I appreciate that. The channel's growing. We want to keep great content flowing for you. So please like, subscribe, share, comment. We'll get back to you. I'm fired up as usual. It's David Darkangelo, another episode of Save Visibility. We'll see you next time. I hope you have a great day. For more information about disability employment issues, please visit our website, disabilityemploymentsolutions.com. The Save As Ability podcast is available on Apple Podcasts, Spotify, our YouTube channel at Disability Policy Expert, or wherever you stream your podcasts. Subscribe, stream, rate, and review our shows. Your ratings and reviews help our show reach new audiences. Produced by Pod Pro Entertainment. Save As Ability lives within a network of podcasts located at podproentertainment.com. #The New Radio. Again, my name is David Darkangelo, and I'm your disability policy expert. Until next time, thank you. I hope you have a great day.